Amanda Hill, who is a senior public health dietitian with the Central Australian Aboriginal or the Central Australian Health Services, and she leads a team of 6 dietitians providing outreach and nutrition services to 30 remote communities and outstations across Central Australia and the Barkly region. She's currently on, I was almost going to say, currently on parental leave with their 5th child, but no, she's on parental leave, raising a 5-month-old baby boy. She'll be presenting on co-designing health remote store food environments. Amanda.
Thank you, Tom. Just trying to share my screen. Is that working for everybody? Oops. Go back to the start. There you go. All right. Yeah, it would be more impressive if I was presenting with my 5th child, but just one. So thank you for the introduction, Tom, and good afternoon, everyone, and thank you for the opportunity to present this work today. I'd first like to take a moment to acknowledge the traditional custodians of the lands on which we are meeting and pay respect to elders past, present and emerging, and extend that respect to all of our Aboriginal and Torres Strait Islander colleagues who are with us here today. I'm currently presenting from Larrakia country up in Darwin, although this research is based on Aranda country down in Central Australia. I'm also presenting on behalf of a research team, and this is a collaborative project between NT Health, Monash University, Outback Stores and Menzies School of Health Research. So just a little bit of background to begin with. This project is looking at the health promoting capacity of remote Aboriginal stores. Could you just hang on one second? I've just got something to... I'm really sorry about that. Just had someone knock at the door and no one is here. So the project is looking at the health promoting capacity of remote Aboriginal community stores. We know from previous research that the food retail environment drives the food choices of customers, and that in-store marketing strategies have been found to be effective in reducing sales of unhealthy foods. So in this project, we're utilising an app called Store Scout, which was developed by Menzies School of Health Research in Darwin, and it's now managed by Monash University in Melbourne. This app asks questions around marketing principles, which we call the 4 Ps of marketing, across 7 food categories. These principles of marketing can be applied to either healthy or unhealthy products, and this app objectively assesses how health promoting the food environment is against evidence-based best practice. So just about a little bit about the 4 Ps. What are they? The first is product. So what foods and drinks are actually available in the store? The second is placement, which is where certain foods and drinks can be found in the store, which then affects how easily customers can see and find them. So this is things like having items in the checkout line that we can see while we wait to pay for food, putting things at the front of the store, the back of the store at eye level. So just an example here of an end of aisle display in a high traffic area, and this is obviously one that's promoting healthier products and healthy snack foods. The next P is price, which is relating to price specials or deals that make certain foods or drinks cheaper. So that could be like 2-for-1 deals or price discounting. And the last P is promotion, which is things like posters or signage promoting certain foods and drinks. It can also be like banners on the fridges and stickers and things like that in the store. So these are obviously promoting less healthy choices with the drumstick ice cream and the wagon wheels. So in order to improve the health promoting capacity of the store environment, what we're aiming to do is to improve the marketing of healthy products and reduce that of unhealthy products. This helps to make the healthy choice easier for customers while still allowing them to have a choice of a range of products. So the aims of this project are broadly to enhance the capacity of the public health nutrition workforce in Central Australia in working with remote stores, as well as to co-design strategies to reduce the sales of unhealthy foods based on best practice, together with Aboriginal store owners and communities. This is hoped to be achieved through specialist training of the public health nutrition workforce and giving them access to the Store Scout app to assist with providing objective feedback and evidence-based recommendations to store owners and managers, as well as allowing us to monitor and evaluate changes in the store environment over time. So there's 7 public health dietitians from NT Health in Central Australia who are participating, and they have invited 30 store owners and managers in Central Australia and the Barkly to participate in this project. Recruitment was completed face-to-face wherever possible, but in cases where the dietitian was unable to directly speak with the board of directors or the store manager, we did have a recruitment video which could be used at directors meetings. It explained what the app was, the information that it would provide the store, as well as, I guess, the benefits to the community of these type of changes, and the project outline and the details of informed consent. So from that, community stores could then decide whether or not they would like to take part. We have 17 stores who agreed to participate across 13 remote communities and outstations in Central Australia and the Barkly, which was a 57% uptake. And just to provide a little bit of context to the vast differences in the demographics of those participating stores, they provide for communities ranging from 50 to 1,000 residents. And these communities are a distance of 120 to 750 kilometres from Alice Springs, which is about between 1 to 8 hours drive from the nearest regional centre. And we also have a mix of management represented in this sample. There are some privately owned stores, and then some that are community owned and independently managed, and others that are community owned and managed by a store management group. So this is an outline of our projected project timeline. We're in the very early phases of the project at the moment, with baseline appraisals using the app, with participating stores currently being conducted, and this is hoped to be completed by the end of December this year. Although, as Tom mentioned, we've had widespread flooding, and there's been a few barriers to collecting this data in store. So we'll hope to get it done as soon as possible. From there, the app does generate a practice score out of 100 based on the 4 Ps. So this comes up at the end of the appraisal. The store gets an overall score out of 100, and then there is a score for each of the food categories listed there. So fruit and vegetables, drinks, snack foods, meals and convenience foods, breads and cereals, meat and seafood, and dairy and eggs. The higher the score, or the closer to 100, the healthier the store environment is. So then the app also provides this radar chart, which gives a little more detail on how well that food category is being promoted in relation to each of the 4 Ps. And so it shows where the store is already doing really well in promoting healthy choices and making them easier for customers, as well as areas which could be improved. Then from this data, the dietitians are compiling reports to feedback to the stores. They there's a bit of an example here, include the results from the app, highlight some areas where the store is doing well, as well as some recommendations based on best practice. So these are strategies that have been shown to work in stores from previous research. And then this report will be discussed with the store owners, and an action plan will be co-designed to, I guess, determine what strategies are considered feasible in that store, but also which strategies may be acceptable to the community. So the agreed actions and a target timeframe and the support agreed from the dietitians will all be documented in that action plan. And then the appraisal with the app will be repeated again at 6 months and 12 months to see if any of the practice scores have changed. And then the action plan will be revisited at those times. After the 12-month review, there'll also be the opportunity to discuss with the store owners whether there is any potential to put these actions into policy in order to assist with sustainability longer term. So we do have a limited amount of preliminary data to share with you today. This is from the baseline appraisals of 5 remote stores. So we had an overall mean score of 62%, but quite a large range between 46 to 73%. You can see the individual food category scores on the slide. The highest scoring categories on average so far are the fruit and vegetable category and breads and cereals, both which scored 74% as a mean. This means that there's a wide variety of healthy choices available and that these are easily accessible to customers. The lowest scoring categories on average were snacks and meals and convenience foods at this point. These scored 42% and 44% respectively. These were the only categories that fell below 50%. I guess their food categories where there are typically several items that are, I guess, higher in sugar, salt, fat, nutrient poor foods choices, such as confectionery, crisps, hot chips, pies, sausage rolls, that type of thing, that are represented in a lot of our remote stores. So that may have contributed to lower scores in those categories. And while our project is not collecting health data, altering the food retail environment has previously been shown to influence food purchasing behaviours, which then has flow-on effects for health and wellbeing of communities. So in the Healthy Stores 2020 study, which was conducted in the NT's top end, it was found that by reducing the visibility and promotion of unhealthy foods, it led to a 2.8% reduction in sugar purchases. And other research in the US has indicated that this level of reduction in sugar intake could result in a 10% lower risk of death from cardiovascular disease, which is currently the leading cause of death nationally, but also in our remote Aboriginal communities. So this approach in terms of adjusting the marketing of foods has significant potential to reduce the sales of unhealthy foods and increase the sales of healthy foods, which could then result in improved dietary intakes and help to improve health, as well as management of chronic conditions experienced in remote Aboriginal communities. Thank you.
Well, thank you, Amanda. And I think that cancers are now neck to neck if they're not going to bump cardiovascular as a single biggest cause now.
They are,
they are. Yeah, so
anxiety is still a big factor in
still a massive
causes.
Yeah, they're neck and neck.
Well. Yeah.
Yep. It's a big issue. So, do we have any questions come up?
We don't, but we don't really have time for them either.
Yeah.
Sorry about the interruption.
No, you're right.
Okay, Joe. Yeah, are you participating stores independent or part of remote community stores? Are your participating stores independent or remote community stores?
So there's a mix. There are some privately owned stores, but then there are some community owned stores. So I guess we're referring to independent stores as those that are community owned, but have contracted their own manager. And then there's also the community owned stores, which we would call a store managed group, which would be managed by a bigger group of like a bigger management group,
Yeah, community, yeah. And so they could either be part of the Outback Stores program or in the territory of the Alpa.
Yeah, so those are two of the largest store management groups. Yeah, and we don't have any Alpa stores in our region, but yeah, we do have Outback stores represented in this project. So yeah.